that the vaccines don't work. And so
Right.
it's a house of cards, and this house of cards is going to collapse.
It certainly is, and it's interesting that you brought up the pertussis vaccine, because a couple years ago they started forcing this on, not only because most children get it during infancy, but then they were asking kids ages like 12 through 14 to get it also, again, this booster, in order to attend school. And most of the children who got it, the vaccine, actually were the ones that got pertussis. And I had interviewed a woman who had one of the schools up in the Sacramento area, Natomas. The school actually came to her house with the vaccine, trying to vaccinate her at the door, her daughter, and she slammed the door right on him. I mean, but this is just getting very aggressive.
This
and
is tyranny. This is something
yeah.
out of like Nazi Germany in 1939. This is something, I mean, and I don't say that lightly. When
Right.
they're coming to your door to try to give a shot to your own kid, and they will not prove the safety efficacy of these things. Because here's the other thing that's like any other drug, you have to have safety standards for this. And they'll say that there's safety standards, but there isn't really. Because like
Right.
any drug, you need to have 1,000 patients who have not had the drug, a placebo effect, and 1,000 with to make a comparison. And they have been yet to do that. And the pharmaceutical industry and the doctors will say, well, that wouldn't be fair to the 1,000 kids without it. Well, I say BS. That's not
Right.
fair to the 1,000 kids who get the vaccine.
Yeah, absolutely. And we've seen examples of unvaccinated people in the Amish communities, and they tend to be far healthier. So it's just, as you say, there are a lot of people who would participate in a study like that and not, because they choose not to have their children vaccinated. And that should be the parental choice. That should be the choice of, and you shouldn't be denied your right to FAPE, which is a free and appropriate public education, because you don't want to have your child vaccinated, and you have these sorts of safety concerns. And I know, I'm sorry, go ahead.
No, but what this is about fear. You know, they're trying to scare the crap out of us and say, well, all these childhood diseases will come back. Is that what you want? You want polio to come back? Well, you know, the guy who invented the polio vaccine, Dr. Salk, said in 1961 in a congressional hearing, he said the only people who would have polio in America in the 60s, he said, was because of the only way that they can contact it was because of the polio vaccine.
Right.
So the idea, you see, there's a misperception about diseases, and these are normal, healthy diseases. Even if you have contracted polio, it's something that can be found in the cell lining of your stomach. Now, this doesn't necessarily mean that it's going to cause paralysis. Only in very, very infrequently will that. And like I said, you have to have other underlying things happening in your immune system and in society in general. You have to have, basically, you have to have hygiene problems, nutrition problems, and sanitation problems. All these three problems, nutrition problems, and sanitation problems. All these three. And by the late 1940s, these were all taken care of in the United States. So if you take a look, there's an interesting book to read, and it's Mortality Rates from Colonial Times to 1970 in the United States. Now, all these normal childhood mortality rates for normal childhood vaccines had disappeared by 1950 before the onset of the vaccination program. So let me say that again. So before vaccines were put in place, the mortality rates, people dying from these childhood diseases, were gone, and has nothing. And the CDC and the National Institutes of Health will confirm this. Is that the vaccine regimen that was put in had nothing to do with the disappearing of these mortality rates. It was better hygiene, better nutrition, and better sanitation. As soon as you start putting in, toilets and you start putting in normal sanitation in places, you're going to do away with a lot of these potential diseases, and that's exactly what happened. And so what the pharmaceutical industry and the doctors will like to perpetuate a myth and really a lie is that the vaccines are what claims credit for that, and it's simply not factual.
Yeah, that's absolutely true. If you can even check out the vaccine inserts, and even the pharmaceutical companies, they make it very confusing, but if you read through the fine print, it basically tells you that they don't know if these things work or not. They don't really do true control studies, because usually the placebo group has these adjuvants, like you mentioned, the thimerosal, the formaldehyde. A lot of the placebos have that in there, so they can say, well, we had the same number of people in the control group have neurological Guillain-Barré.
I'm glad you brought that up. I'm glad you brought that up, April, because this is the kind of lunacy. And when I say house of cards, it's a logical, it's an unscientific house of cards. It's going to fall apart because when they say they've done the comparisons, who are they comparing it to? They're comparing the vaccinated kids to the greater population at large. Well, guess what, April? The greater population at large is a vaccinated group as well, with over 90% vaccination. So what are they comparing to? This is not science. This is bogus science. This is unscientific, and it will not hold up. And so what we're looking at here is we're looking at a tyranny. We're looking at a government that is overstepping its bounds, and this won't hold. I mean, and I'm thinking like, I'm trying to compare this to. It's like the Civil Rights Movement in 1954. And I don't exaggerate this because we're talking about 1 out of every 88 kids in America now has autism. And for boys, it's 1 out of 56 because boys are genetically more susceptible. It takes, longer for their, for them to get stronger, their immune systems. So they're more susceptible genetically. So we're talking about millions and millions of kids, and who's going to take care of these kids? Who's going to pay for that? We already have a society that's teetering on bankruptcy because of these, continued, warmongering. We have to. The parents have to be the arbiters of our child's health and make the best decisions for them. Now, look, if there is a chance that you might be moving to Nigeria or Kenya, and then you have to think about, well, you know what? Diphtheria is something that does happen there. You have to consider that, okay, what you would do is maybe divide those 3 pills and say, listen, we're going to live for 3 years, and I have a 3-year-old. We have to make a choice, and maybe that is a toxic choice that you would make for your child to maybe get a diphtheria shot, but you wouldn't have to a vaccine. You'd think about that. But in America, that is simply non-existent and is not a problem, and it only exists because the pharmaceutical industry has been indemnified from getting any lawsuits, and so is your pediatrician. Like your pediatrician, April, you had no recourse. If something does go wrong, like with your child, you would have to sue and go to this thing called a special court.
Right.
Which, by the way, a special court is really hard for the parent. You would have to prove and do your own research and prove, and if you didn't write down the vaccine number and the date and the pharmaceutical industry, the pharmaceutical company that made that, you're up crap creek. You're not going to be able to prove it. And then, you're stuck. And then you have to deal with the expense. The pediatrician's gone, and you have it's up to you to do it. And now, even with this stringent regard, even with these stringent controls, there's still been over $2 billion, with a B, $2 billion in the last 2 decades have been paid out to families of children who've died and been severely injured from vaccines.
Yeah, that's a lot. And from what I remember reading about this, when they, in the 1980s, when they did sort of give the, pun intended, I guess, the vaccine, the pharmaceutical industry immunity to being sued for liability for these, the reason that they had to do that was because there were so many lawsuits that it was actually going to stop the vaccination program.
I mean, truthfully, what the numbers are is that once you start talking about allergic reactions, once you start talking about, I mean, I was in Missouri, and I was in Missouri a few weeks ago, and I was literally just getting a haircut, and I was talking to, the woman cutting my hair and her husband who was there, and I was talking, and we brought up about how are their kids doing, and one of their kids had some problems, and after talking to them for a while, you realize they had a vaccine-injured child and and kind of knew it but didn't know what to do. And they're a Vietnamese couple, so the Asian people, are very much, they want to trust into a system. We all want to trust that our doctors know what they're doing. We want to trust that our medical establishment, that the hospitals know what they're doing. And so after talking to them, they said, yeah, we know that this is, as soon as we had this triple MMR shot, that was when the problems began. He started to have a regression, and he's autistic. And, people don't even know. So I'm saying that there is probably millions more cases. I'm going to say something that's staggering, and I got this from Dr. Julian Whitaker, one of the few doctors. He's in Newport Beach, California. And for your listeners out there who have a vaccine-injured child, they have a very good program with chelation therapy, with vitamin therapy, to try to help turn things around for your doctor, non-gluten diets, just like what April, what you're doing.
Yes.
And he said that as much as 50%